It's early on a cold Tuesday in January, and Cindy Shively rises in the dark. She exercises, feeds her border collie, her cat, and her 4 chickens, and then makes coffee and breakfast for herself and packs a lunch for her husband. By 7, she's headed for work in her tan Subaru, cruising along windy country back roads. Shively, who's 51, has been the sole full-time clinician at the Franklin County Free Clinic since 2013. In Rocky Mount, Virginia, a rural town 65 miles south of Lynchburg, 40% of residents live on less than $20,000 a year. It wasn't always that way. Franklin County was once home to 2 thriving furniture factories and busy textile and paper mills, but now many of those jobs and the health insurance that went with them are gone. Today, the Free Clinic has a roster of nearly 800 patients, more than half of whom are being treated for a mental illness.
There's no way you can be healthy physically for any period of time if you are chronically depressed or bipolar or whatever. You may tolerate, or you may have the coping mechanisms to go along for a while, but eventually you're gonna be physically sick as well.
Being poor, says Shively, is a difficult and full-time job. Proving eligibility for services can be cumbersome, lengthy, and demeaning, and day-to-day life is often stressful and chaotic, and that stress can cause, reveal, or make worse mental illnesses that otherwise lie dormant.
I would say that well over 50%, probably as much as 80% of our patients actually have a dual diagnosis of some sort with a mental health issue.
A lot of depression, a lot of anxiety, some situational, obviously, because we are dealing with a largely unemployed or underemployed population.
I think it is a reflection of the fact that we're a small rural community, and also because our folks live in poverty, and I think the statistics show that people who live in poverty have a higher incidence of depression and anxiety and drug abuse, other mental health related issues, just because of the stress of living in poverty.
1 in 5 Americans suffers from a mental illness, but unlike flu shots and cholesterol screenings, mental health care often doesn't come until a crisis hits. It was her patients' mental health needs that drove Shively back to grad school. So did the fact that the area's mental health clearinghouse, Piedmont Community Services, was constantly stretched beyond capacity. Patients who'd reached out for psych services sometimes waited weeks and even months to be seen. But soon, that'll change.
They're thrilled that I'm doing this postmasters thing so that hopefully we'll be able to take a little bit of their caseload off of them, even if it's, hopefully I would see it being as more the stable patients that I can manage chronically, and with some interaction between the psychiatrist and myself, and then it would free them from more of those acute issues that need to be dealt with that doctor. That's the crux of the primary care provider. That's our issue, is to chronically manage the disease process.
Already, Shively's understanding of and ability to treat patients with mental illness has been expanded, and by 2019, when she graduates, her patients will reap the benefit of her time at UVA.